The conference room on the 4th floor of St. Vincent's Hospital felt smaller than it should have. Dr. Maya Santos stood at the far end of the long mahogany table, her hands clasped behind her back in a posture she didn't realize she'd adopted. 4 physicians sat in leather chairs, their expressions ranging from bored to barely concealed satisfaction. At the head of the table, Dr. Richard Carmichael adjusted his reading glasses and glanced down at the manila folder spread open before him. "Nice uniform, Dr. Santos." He looked up, his lips curling into something that might have been a smile if there had been any warmth behind it. "Combat boots with scrubs? What is this? Some kind of fashion statement?" Maya's eyes dropped to her feet. Black tactical boots, worn but meticulously maintained, laced tight the way she'd learned years ago. She'd meant to change them before this meeting. She'd forgotten. One of the other doctors, a man with silver hair and a perpetual smirk, chuckled softly. The sound echoed in the quiet room. "I wasn't aware the dress code had changed," Carmichael continued, leaning back in his chair. "Perhaps you thought we were running field operations here instead of a level 1 trauma center." Maya kept her face neutral, her jaw set. She'd learned a long time ago that silence was often the best defense. Let them talk. Let them think they had the upper hand. It didn't matter anymore. Carmichael closed the folder with deliberate slowness, the pages making a soft thud as they came together. "Dr. Santos, effective immediately. Your residency contract with St. Vincent's Hospital is terminated." The words hung in the air like smoke. Maya didn't flinch. She'd known this was coming the moment she'd received the summons at 6:30 that morning. She'd known it was over. The reasons are outlined here. He tapped the folder with one manicured finger. "Multiple violations of protocol, insubordination, performing procedures without attending supervision." The list goes on. "Frankly, Dr. Santos, I'm not sure how you made it through medical school with this kind of attitude." Maya's hands tightened behind her back, fingers pressing into her wrists. She felt the edge of her watch, the cool metal against her skin. And beneath it, the small tattoo she kept hidden. A medical caduceus with wings, rendered in black ink. Not the civilian kind, the military one. "Do you have anything to say for yourself?" Carmichael asked, though his tone suggested he didn't particularly care what her answer might be. "No, sir." Her voice was steady, controlled. She'd practiced this tone until it became second nature. Respectful, but not submissive. Clear but not emotional. "No?" Carmichael's eyebrows rose. "No apology? No explanation? Nothing? What would you like me to say?" Maya met his eyes for the first time since entering the room. "That I'm sorry for saving a patient's life when you told me to wait? That I regret performing a cricothyroidotomy on a man who was choking to death because the attending was stuck in another surgery?" One of the other doctors shifted uncomfortably in his seat. Maya saw the movement in her peripheral vision, but didn't look away from Carmichael. "You performed that procedure without authorization," Carmichael said, his voice rising slightly. "You were explicitly told to wait for senior staff. Instead, you took it upon yourself to... The patient would have died." Maya's voice didn't rise to match his. She kept it level, factual. He had a complete airway obstruction. No air movement. Cyanosis setting in. I had maybe 90 seconds before brain damage became irreversible. I made the incision, inserted the tube, and he lived. If that's grounds for termination, then I accept your decision." The room fell silent again. The other physicians looked at each other, then at Carmichael, who had gone slightly red in the face. Outside the window, Chicago's early morning traffic hummed along the streets below, oblivious to the small drama playing out 4 floors above. "You have until 8 o'clock to clear out your locker," Carmichael said finally. His voice clipped. "Security will escort you from the building. Your final paycheck will be mailed to your address on file. And Dr. Santos?" He leaned forward slightly. "I'll be making sure your file reflects the reasons for your dismissal. Good luck finding another residency position after this." Maya nodded once. Understood. She turned toward the door, her movements precise and economical. Military bearing, though she tried to hide it. She'd been trying to hide it for 6 months now, ever since she'd walked away from everything she'd known, and started over as just another resident in just another hospital. Her hand was on the door handle when Carmichael spoke again. "One more thing." She paused, but didn't turn around. "Those boots? They're not regulation. Next time you apply somewhere, try to look like a doctor instead of a soldier." Maya's fingers tightened on the handle for just a moment. Then she opened the door and walked out, letting it close softly behind her. The hallway outside was empty, the fluorescent lights humming overhead. She walked toward the elevators, her boots making soft sounds on the linoleum floor. In the reflection of a darkened office window, she caught sight of herself. Dark hair pulled back in a low ponytail, scrubs that hung a bit loose on her frame, and those damn boots. She looked tired. She looked like someone who hadn't slept properly in months. The elevator dinged, and the doors slid open. Maya stepped inside and pressed the button for the ground floor where the locker rooms were located. As the elevator descended, she caught sight of her reflection again in the polished metal doors. She touched her left wrist unconsciously, feeling the outline of the tattoo beneath her watch. Hidden, just like everything else about who she really was. The locker room was quiet when she arrived. Most of the early shift residents were already upstairs, starting rounds or prepping for morning surgeries. Maya's locker was in the far corner, number 247. She spun the combination lock automatically, the numbers coming to her fingers without conscious thought. Inside, the space was sparse. 3 pairs of scrubs, a change of civilian clothes, a toothbrush, and a small wooden box wrapped in a black cloth. She stared at the box for a long moment, then reached for it. Her fingers brushed the smooth wood, and she felt the weight of memory pressing down on her shoulders. She hadn't opened it in 6 months. She wasn't going to start now. Maya left the box where it was and began pulling out the scrubs, folding them mechanically. 6 months ago, she'd walked into this hospital with a carefully constructed story and a desperate need to leave her past behind. She'd thought she could do it. She'd thought she could be someone different, someone normal, someone who just followed the rules and didn't make waves. But some things you can't escape. Some things follow you no matter how far you run. And sometimes, the very skills that make you exceptional are the ones that get you fired. She was zipping up her duffel bag when she heard it. The sound was distant at first, coming from somewhere above. Then it grew louder, more urgent. The hospital's trauma alert system, the mechanical voice echoing through the hallways. Mass trauma alert. Multi-vehicle collision on Interstate 90. Multiple casualties incoming. Estimated time of arrival, 8 minutes. All available staff report to emergency department immediately. Repeat. All available staff to emergency immediately. Maya's hands froze on the zipper. She stood there, listening as the alert repeated, as she heard the sound of running footsteps in the hallway above, as the familiar adrenaline started to course through her veins. 8 minutes. She looked down at her bag, then at the locker, then at her hands. Steady hands. Trained hands. Hands that had performed over 600 surgeries in conditions most civilian doctors couldn't imagine. She was already fired. They couldn't take anything else from her. But they could use her. For the next few hours at least, they could use her. Maya shouldered her bag, closed the locker, and headed for the stairs. The emergency department at St. Vincent's was controlled chaos by the time Maya pushed through the double doors. Nurses moved with practiced urgency between treatment bays, their voices calm but clipped as they called out orders and vitals. The smell of antiseptic mixed with blood hung in the air, a scent Maya knew better than most. Somewhere down the corridor, a monitor was beeping insistently, and she could hear Dr. Kevin Park's voice rising above the noise, asking someone to page cardiology. Maya stepped to the side, her back against the wall, and scanned the room. 3 ambulance crews were already there, transferring patients onto gurneys. A woman in her 40s was being wheeled past, her face pale, an oxygen mask covering her nose and mouth. Behind her came a teenager with a cervical collar, conscious but dazed. And then a man on a backboard, his construction vest torn and stained dark with blood. She shouldn't be here. She'd been fired less than an hour ago, but her feet had carried her up those stairs anyway, and now she was watching the organized chaos unfold, like a symphony she knew by heart. "Dr. Santos?" The voice came from her left. Maya turned to see Nurse Linda Chen approaching, her short black hair slightly disheveled, her eyes sharp and assessing. Chen was 42, a former Navy corpsman with 18 years of trauma experience, etched into every efficient movement she made. What are you doing here? I thought Carmichael fired you. He did. Maya kept her voice low. I was leaving when the alert came through. Chen studied her for a moment, then glanced over her shoulder at the treatment bays, where staff were scrambling to manage the influx of patients. She looked back at Maya. We're short-staffed. 3 residents called in sick, and 2 attendings are stuck in surgery. This collision brought in 7 patients, and we're hearing there might be more coming from a second accident site. I'm already terminated, Maya said. I can't treat patients here. Chen's expression didn't change, but something flickered in her eyes. Maya, I don't care what Carmichael said. We have people dying, and you're one of the best trauma residents I've worked with in 2 decades. You in or not? The question hung between them for just a moment. Then Maya nodded once and dropped her duffel bag against the wall. Where do you need me? Bay 4. Construction worker, 52 years old. Preliminary assessment says fractured ribs, possible pneumothorax. He's stable for now, so he's lowest priority. Chen handed Maya a tablet with the patient's chart already pulled up. Keep him monitored while we handle the critical cases. And Maya, she lowered her voice, stay out of Carmichael's sight. If he sees you, this conversation never happened. Maya took the tablet and headed for Bay 4. As she walked, she caught snippets of conversation from the other residents. Doctor. Amanda Foster was in Bay 2, her voice tight with stress as she worked on a patient with abdominal trauma. Dr. Park was in Bay 1 with what sounded like a severe head injury. Everyone was stretched thin, moving too fast, making decisions on the fly. She pulled back the curtain to Bay 4. The patient was lying on his back, his eyes closed, his breathing shallow but regular. His name, according to the chart, was Michael Torres. Construction foreman. 2 young daughters waiting at home, according to the emergency contact information. Maya set the tablet down and moved to his side, her hands already reaching for her stethoscope. Mr. Torres? Her voice was gentle but clear. I'm Dr. Santos. I'm going to examine you. Can you tell me where it hurts? His eyes opened slowly, focusing on her face. Chest. Right side. Hurts to breathe. Maya placed her stethoscope against his chest, listening carefully. Breath sounds were present on both sides but diminished on the right. She moved the stethoscope lower, then to his back. The pattern was consistent with fractured ribs, exactly as the preliminary assessment had indicated, but something else was there too, something subtle that made her pause. She pressed her fingers gently along his neck, feeling for the jugular veins. There, a slight distension, not obvious, but present. She checked his pulse at the wrist, then at the carotid artery, counting silently. Then she had him take a deep breath while she measured his blood pressure. The reading dropped 15 millimeters of mercury during inspiration. Pulsus paradoxus. Maya's mind went through the differential diagnosis in seconds. Fractured ribs, yes, but also something more dangerous. Something that would kill him if it wasn't caught in time. She pulled back the curtain and looked for Chen, who was coordinating with another nurse near the central station. Maya caught her eye and gestured for her to come over. Chen excused herself and walked to Bay 4, her expression questioning. I need you to look at something, Maya said quietly, angling her body so Mr. Torres couldn't hear. Watch his neck veins while he breathes. Chen moved closer, her eyes following Maya's instruction. After a moment, her expression shifted. That's JVD. Subtle, but it's there. Combined with decreased breath sounds on the right, pulsus paradoxus, and probable rib fractures. Maya kept her voice clinical, factual. He's developing cardiac tamponade, probably from a sternal fracture we haven't visualized yet. Slow bleed into the pericardial sac. He's stable now, but in 10 minutes, maybe 15, he's going to crash. Chen's face went still. You're sure? Maya met her eyes. I've seen this before, multiple times. Chen didn't ask where or when. She just nodded and stepped back. I'll get Carmichael. He needs to authorize a pericardiocentesis. No time for that, Maya started to say, but Chen was already walking away. Her pace quick, but not panicked. Maya turned back to Mr. Torres, who was watching her with growing concern. Something wrong, Doc? We're going to take good care of you, Mr. Torres. Maya adjusted his oxygen mask, checking the flow rate. Just relax and try to breathe normally. She watched the monitor, tracking his vitals. Blood pressure was holding at 118/76. Heart rate was 88. Oxygen saturation was 97%. All within normal ranges. But she knew what was coming. She'd seen it too many times in field hospitals, in forward operating bases, in places where protocols were guidelines, and survival was the only metric that mattered. Chen returned 3 minutes later, and she wasn't alone. Doctor. Richard Carmichael followed behind her, his face set in an expression of barely controlled anger. When he saw Maya standing at the bedside, his jaw tightened. Dr. Santos. His voice was cold enough to freeze the air between them. I thought I made myself clear this morning. You are no longer employed by this hospital. Maya didn't move. I was leaving when the trauma alert came through. Nurse Chen asked me to help with the overflow. Carmichael's eyes flicked to Chen, who stood her ground. We were short-staffed, Director. I made a judgment call. A judgment call, Carmichael repeated. He turned his attention back to Maya. And now I'm told you're diagnosing cardiac tamponade in a patient whose vitals are completely stable. He glanced at the monitor. Blood pressure is fine. Heart rate is fine. This is exactly the kind of overreach that got you fired in the first place. Maya kept her voice level. He has jugular venous distension, pulsus paradoxus, and diminished breath sounds on the right. Those are 3 components of Beck's triad. The 4th, hypotension, is developing. It's just not obvious yet because the accumulation is slow. Carmichael stepped closer to the bed and looked at Mr. Torres, who was now looking increasingly worried. He placed his fingers on the patient's neck, checking the veins. After a moment, he straightened. I don't see any significant JVD. His vitals are within normal parameters. You're seeing patterns that aren't there, Dr. Santos. Sir, Maya started, but Carmichael cut her off. This patient has fractured ribs. That's all. He needs pain management and observation. What he doesn't need is an overzealous terminated resident performing unnecessary invasive procedures. He turned to Chen. Get Dr. Santos out of this department. Now. And if I see her in this hospital again, I'll have security remove her permanently. Maya looked at Mr. Torres, whose eyes were locked on hers. She could see the fear there, the instinctive trust a patient places in a doctor who seems to care. Then she looked at the monitor. Blood pressure was down to 110/72. Still within range, but dropping. She made a decision. Sir, with respect, if you don't let me treat this patient, he'll be dead in less than 10 minutes. Carmichael's face went red. Get out. Now. Or I'll call security myself. Maya didn't move. And somewhere in the distance, an alarm started to sound. The alarm wasn't coming from Bay 4. It was coming from somewhere down the hall, followed by a nurse's urgent voice calling for assistance. But Maya's eyes stayed locked on the monitor beside Michael Torres. His blood pressure had dropped again. 100/68. Heart rate climbing to 94. The numbers were still within acceptable ranges by civilian standards. But Maya had learned to see beyond the numbers. She'd learned to read the trajectory of decline, to predict the moment when stable became critical. Carmichael was already walking away, dismissing her concern with a wave of his hand. Chen stood between them, her expression caught between professional duty and something that looked like belief. Maya made her decision in the space of a single breath. She stepped back into Bay 4 and pulled the curtain closed behind her. Mr. Torres was watching her, his eyes wide with growing fear. The kind of fear that comes when you realize the people arguing about your care might not all agree on what's wrong with you. Mr. Torres, I need you to trust me. Maya's voice was calm, steady, the tone she'd perfected in field hospitals when time was running out and panic would kill faster than any wound. Your heart is under pressure from fluid building up around it. I need to drain that fluid, or you're going to go into cardiac arrest in the next few minutes. His hand reached out and gripped her wrist. The doctor out there, he said, I'm fine. He's wrong. Maya met his eyes. I've seen this injury dozens of times. I know what I'm doing. But I need your consent. Do you trust me? For a long moment, Mr. Torres just stared at her. Then he nodded. Once. Do it. Maya moved fast. She grabbed the portable ultrasound machine from the corner of the bay and wheeled it to the bedside. Her hands moved over the controls with practiced efficiency, adjusting settings, selecting the cardiac view. She placed the probe on his chest, angling it beneath the sternum, and the screen lit up with the gray and black image of his heart. There, a dark stripe around the ventricles, pericardial effusion, at least 300 milliliters. The heart was being compressed, squeezed by the accumulating blood. In another 5 minutes, maybe less, it would stop beating altogether. The curtain snapped open. Nurse Chen stood there with a procedure tray in her hands. Her face was set in an expression Maya recognized. The look of someone who'd made a choice and was prepared to live with the consequences. Pericardiocentesis kit, Chen said, setting the tray down on the bedside table. 18-gauge spinal needle, local anesthetic, sterile drapes. Everything you need. Maya looked at her. Carmichael said no. Carmichael walked away. Chen's voice was quiet but firm. I'm the senior nurse in this department, and I'm authorizing this procedure under emergency protocol. If he fires me too, so be it. But I'm not watching this man die because of administrative pride. Maya didn't waste time arguing. She tore open the sterile packages, her movements economical and precise. Gloves, betadine prep, draped the field. Mr. Torres lay still, his breathing shallow, his eyes fixed on the ceiling. She could see his pulse beating in his neck, fast and thready. Local anesthetic first. Maya found the landmark, the spot just below the xiphoid process where the needle would enter at a 30-degree angle toward the left shoulder. She injected the lidocaine, watching Mr. Torres's face for any sign of distress. Then she reached for the spinal needle, long and thin, attached to a syringe. Ultrasound probe. She positioned it to give her a real-time view of the needle's path. On the screen, she could see the heart, the dark fluid surrounding it, the trajectory she needed to follow. Her left hand held the ultrasound steady. Her right hand guided the needle through skin, through muscle, through fascia, advancing now. Her voice was barely above a whisper, though she wasn't sure if she was talking to Chen or to herself. The needle moved deeper, millimeter by millimeter. On the screen, she watched its progress. A bright white line pushing through tissue. Approaching pericardium. Mr. Torres's monitor started alarming. Blood pressure 85/52. Heart rate 108. He was crashing, exactly as she'd predicted. His lips were turning pale, his breathing more labored. Almost there. Maya's hand was rock steady. The needle touched the pericardial sac, and she felt the subtle give as it penetrated the membrane. Blood, dark and thick, filled the syringe. She pulled back slowly, aspirating, drawing out the fluid that was killing him. 50 milliliters. 100. 150. The syringe filled with blood, and on the monitor the numbers began to change. Blood pressure rising. 88/55. 92/58. 100/64. Mr. Torres took a deep breath, the first full breath he'd taken in minutes. The color started returning to his face. Maya kept aspirating, watching the ultrasound screen, making sure she didn't pull too much, didn't cause more damage than she was fixing. 200 milliliters total. She withdrew the needle carefully, applied pressure to the site, and checked the monitor one more time. Blood pressure 112/70. Heart rate 90. Oxygen saturation 98%. Behind her, she heard voices. Multiple voices. She turned to see Carmichael standing at the entrance to Bay 4, his face a mixture of shock and rage. Dr. Park was beside him, and Dr. Foster, and 3 nurses she didn't recognize. They were all staring at her. What did you just do? Carmichael's voice was dangerously quiet. Pericardiocentesis. Maya stripped off her gloves and dropped them in the biohazard container. 200 milliliters of blood aspirated from the pericardial sac. Patient is stabilized. He'll need cardiothoracic surgery consult for definitive repair, but he's no longer in immediate danger. Carmichael stepped into the bay, his eyes moving from Maya to the ultrasound screen to Mr. Torres, who was breathing easily now, his color almost normal. You performed an invasive procedure without authorization, without attending supervision. You could have killed him, but I didn't. Maya's voice remained calm. I saved him. Check the ultrasound images if you don't believe me. Check his vitals. He was in cardiac tamponade, exactly as I diagnosed. And if I'd waited for authorization, he'd be dead. Dr. Park moved closer to the ultrasound machine, studying the screen. His expression shifted as he saw the images, the before and after, the clear evidence of pericardial effusion that was now drained. He looked at Maya with something that might have been respect, might have been disbelief. How did you know? His vitals were stable 15 minutes ago. They were compensating. Maya kept her eyes on Carmichael. I've seen this presentation before. The body can maintain blood pressure through vasoconstriction and increased heart rate, but only for so long. Once decompensation starts, it happens fast. I had maybe 4 minutes from the time I started the procedure to the time he would have arrested. Carmichael said nothing. He stood there, looking at Mr. Torres, at the monitor, at the evidence that Maya had been right and he had been wrong. Around them, the emergency department continued its chaotic rhythm. Someone was calling for an intubation kit. Another alarm was sounding from Bay 2. The world kept moving, indifferent to the small drama playing out in Bay 4. Finally, Carmichael turned to Chen. Document everything. Full procedure note, consent form, complication report. He looked back at Maya. You're still fired, Dr. Santos, but you just saved this man's life, and I'm not going to pretend otherwise. He paused at the curtain. And those boots. Maybe they're exactly what we need in this department. He walked away, leaving Maya standing beside the bed, her hands finally beginning to tremble with the adrenaline she'd been suppressing. Mr. Torres reached out and touched her arm. Thank you. His voice was hoarse but clear. Thank you for not giving up on me. Maya nodded, not trusting herself to speak. Chen was already at her side, handing her a tablet to document the procedure. But before Maya could start typing, the overhead speakers crackled to life with a new announcement, and the words made everyone in the emergency department freeze. Trauma alert level red. Officer down. Gunshot wound to chest and abdomen. ETA 4 minutes. Second ambulance with civilian casualties from same incident. Multiple GSWs. All available staff prepare for mass casualty. The emergency department erupted into coordinated movement. Nurses pulled crash carts toward the trauma bays. Residents abandoned non-critical patients and rushed to prepare for incoming casualties. The overhead lights seemed brighter suddenly, the air sharper, charged with the electricity of impending crisis. Maya stood in Bay 4, listening to the echo of the announcement, feeling the familiar surge of adrenaline that came with mass casualty scenarios. Officer down. Gunshot wounds. Multiple civilians. The words triggered memories she'd spent 6 months trying to bury. Forward operating bases. IED attacks. Convoys ambushed on desert roads. The smell of blood and diesel fuel mixing in 100-degree heat. Carmichael appeared at the central nursing station, his voice cutting through the chaos. Listen up. We have 4 minutes before the first ambulance arrives. Dr. Park, you take Trauma Bay 1 for the officer. Dr. Foster, Bay 2 for the first civilian. Dr. Hassan, Bay 3 for the second civilian. He paused, his eyes scanning the room, landing on Maya. Dr. Santos, Bay 6. Third civilian, stable gunshot wound to the shoulder. Just wound management. Don't do anything beyond your scope. Maya nodded once. Chen caught her eye and gestured toward Bay 6, already pulling equipment from storage. The unspoken message was clear. Stay out of trouble. Do your job. Don't give Carmichael another reason to throw you out. The first ambulance arrived 3 minutes and 40 seconds later. The automatic doors burst open, and paramedics wheeled in a gurney carrying a man in a dark blue uniform. Federal Police. Maya could see the badge on his vest even from across the room. His face was pale, an oxygen mask covering his mouth and nose, and his chest was wrapped in pressure bandages that were already soaked through with blood. Male, 31 years old. The lead paramedic's voice was rapid, clipped. GSW to right anterior chest. Entry wound just below the clavicle. Exit wound posterior. Massive hemothorax. Blood pressure 70/40 and dropping. Intubated in the field. He's had 2 liters of fluids and 2 units of O negative. We're losing him. Bay 1. Carmichael pointed. and the gurney rolled past Maya in a blur of motion. She caught a glimpse of the officer's face. Young, maybe late 20s, his eyes closed, his skin the color of old paper. Dr. Park was already scrubbing, pulling on gloves, shouting orders to the nurses preparing the bay. Second ambulance. A woman, maybe 28, conscious but in shock. Her hands were pressed against her abdomen, blood seeping between her fingers. Her eyes were wide, darting around the room like a trapped animal. GSW to abdomen. The paramedic was a woman Maya recognized from previous shifts. Entry wound left upper quadrant. No exit wound. Vitals are holding, but she's got free fluid in the belly. Needs immediate surgical intervention. Bay 2. Dr. Foster took charge, her voice steady as she directed the transfer. The woman on the gurney was crying, saying something about her daughter, about needing to call someone. Foster's hand touched her shoulder, reassuring, professional, before the curtain closed behind them. Third ambulance. A man, mid-40s, screaming in pain. His left thigh was wrapped in a tourniquet, blood pooled on the gurney beneath him. GSW to left femoral region. Arterial injury. We've got proximal control with the tourniquet, but he's lost at least 2 liters. Blood pressure 90/55, heart rate 130. Bay 3. Dr. Hassan was already moving, his face set in concentration. The man's screams echoed through the department until the curtain closed and someone administered pain medication. Fourth ambulance. Maya straightened as the doors opened again. This one was different. The patient was sitting upright, his right arm in a sling, his face tight with pain, but composed. He wore the distinct uniform of the United States Army. Dress uniform, she realized. The kind soldiers wore to formal events, to ceremonies, to testify in court. His shoulder was bandaged, but the bleeding appeared controlled. The paramedic pushing the gurney looked almost apologetic. Captain James Rodriguez, 29 years old, U.S. Army. GSW through and through to right shoulder. Missed major vessels, no pneumothorax, stable vitals. He refused to be taken to military medical but insisted on civilian ER. Said he needed to make a statement to federal investigators. Bay 6. Maya met them as they wheeled him in. The captain's eyes found hers immediately, and there was something in his gaze. Recognition? No, that wasn't possible. She'd never seen this man before in her life. Captain Rodriguez. Maya kept her voice professional as they transferred him to the hospital bed. I'm Dr. Santos. Let me take a look at that shoulder. His left hand reached out and gripped her wrist. Not hard, but firm enough to make her pause. I know you. Maya's heart stuttered. You're mistaken, Captain. I don't think we've met. Ramadi. His voice was quiet but certain. 2019. Field hospital outside the city. IED hit our convoy. I had shrapnel in my chest, collapsed lung. You did an emergency thoracotomy right there in the dirt while mortars were falling. The room tilted slightly. Maya forced her expression to remain neutral, but inside everything was screaming. This can't be happening. Not now. Not here. Captain, you've been through a trauma. Sometimes pain and stress can cause confusion. No confusion. Rodriguez's grip tightened slightly. You had blood all over your uniform. Your hands were steady even when the explosions were so close they shook the ground. You told me to stay awake. Told me about your family back home to keep me conscious. You saved my life, Major Santos. The title hit her like a physical blow. Major. He knew. He knew everything. From the other side of the department, Maya heard raised voices. Dr. Park's voice, tight with stress. I can't control this bleeding. Carmichael, I need help. The chest tube isn't draining, he's crashing. Then Dr. Foster, her voice carrying a note of panic Maya hadn't heard before. My patient's blood pressure is dropping. I can't find the source. It's somewhere in the retroperitoneum, but I can't visualize it. Then Dr. Hassan. The artery retracted into the muscle. I've been trying to clamp it for 5 minutes. I can't get proximal control. Maya's training screamed at her to move, to help, to do what she'd been trained to do. But she was fired. She was supposed to stay in Bay 6, manage a simple shoulder wound, and disappear. 3 patients were crashing simultaneously. And she was the only person in this department who'd managed scenarios like this before. Hundreds of times. In conditions that made this clean, well-lit emergency room look like paradise. Captain Rodriguez was still watching her. His voice dropped to barely above a whisper. "Major, they need you. Those people are dying. I can hear it in their voices. I'm not a major anymore." Maya's voice was hollow. "I resigned 6 months ago. I'm just a resident. A fired resident. You're a combat surgeon." Rodriguez released her wrist. "And right now, 3 people need a combat surgeon, or they're going to die in the next 5 minutes. Maya looked at him, then toward the curtains where she could hear the sounds of organized chaos devolving into desperate improvisation. She thought about Michael Torres in Bay 4, alive because she'd refused to accept limitations. She thought about every patient she'd saved in places where protocols didn't exist, and survival was the only metric that mattered. She thought about Private Marcus Webb, dying on her table while mortars fell, and how she'd promised herself she'd never let that happen again if she could prevent it. Then she heard it. The sound that every emergency physician dreads. The long, continuous tone of a flatline monitor. From Bay 1, the police officer. Maya stripped off her gloves and walked out of Bay 6. Captain Rodriguez called after her. "Go save them, Major. Show them what you can do." Nurse Chen appeared at her side as Maya crossed the department. The senior nurse's face was grim. "All 3 are coding." Park froze on the chest case. "Foster can't control the abdominal bleed. Hassan lost the femoral artery. We're about to lose 3 patients in 8 minutes. Maya reached the center of the emergency department. Around her, the chaos had reached a breaking point. Monitors alarming. Nurses running between bays. Residents shouting for help that wasn't coming fast enough. And in the middle of it all, Dr. Richard Carmichael stood frozen, his face pale, his eyes moving between the 3 trauma bays like a man watching a building collapse and unable to decide who to save first. Maya's voice cut through the noise, clear and commanding. "Everyone listen. I'm taking command of this trauma." She looked directly at Carmichael. "Step aside, Director. Let me work." Carmichael's face went from pale to red in the span of a heartbeat. "What did you just say to me?" Maya didn't repeat herself. She was already moving toward Bay 1, where the flatline tone continued its death song. Dr. Park stood frozen beside the gurney, his gloved hands hovering uselessly over the police officer's open chest. Blood pooled in the cavity, dark and thick, and the chest tube dangling from the patient's right side was barely draining. "Report." Maya's voice cut through Park's paralysis like a scalpel. He looked up at her, his eyes wide with something that looked like relief mixed with shame. "Massive hemothorax. Bullet track through the upper lobe. I placed a chest tube, but it's not draining effectively. I think the lung is shredded and bleeding into the pleural space faster than I can evacuate it. He's been flatlined for 90 seconds. Maya pulled on fresh gloves, her movements automatic. Chen appeared at her elbow with a thoracotomy tray. The instruments gleamed under the harsh lights. Rib spreader. Maya didn't ask permission. She didn't wait for approval. Her hands moved with the precision born from doing this procedure dozens of times in conditions far worse than a clean emergency department. The scalpel made a swift incision along the 5th intercostal space, and she could hear Park's sharp intake of breath as she worked. "What are you doing? That's not protocol for ED thoracotomy placement. This isn't standard thoracotomy." Maya's fingers found the space between the ribs. "This is damage control. The kind you do when someone's dying and you have 90 seconds to fix it." She inserted the rib spreader and cranked it open. The officer's chest cavity revealed itself, filled with blood and the torn tissue of his lung. There. Maya's hands moved through the blood, feeling for the source. Intercostal artery. Bullet nicked it. She grabbed a vascular clamp from Chen's outstretched hand. Clamping now. The bleeding slowed immediately. "Park, I need you to start cardiac massage. Direct. Put your hands on his heart." Park hesitated for only a second before his hands entered the chest cavity. His fingers wrapped around the silent heart and began to squeeze, rhythmic and mechanical. Maya tied off the intercostal artery with sutures that appeared in her hands as if by magic, placed there by Chen, who seemed to anticipate every move. Monitor. The flatline had given way to a weak, irregular rhythm. Keep massaging. We're getting electrical activity. Maya packed the lung with surgical gauze to control the smaller bleeding points. He needs definitive repair in the OR, but he's stable enough to move now. She looked up at Park, whose face had gone from panicked to focused. Good work. Maintain that rhythm. She turned to Chen. Get OR prepped for emergency thoracic surgery. Patient moves in 5 minutes. Then she was moving again, crossing to Bay 2, where Dr. Foster's voice had taken on a high, thin quality that spoke of controlled terror, barely holding. Maya pulled back the curtain. The woman with the abdominal gunshot wound was on the table, her abdomen open. Foster's hands inside trying to find a bleeder she couldn't locate. Talk to me. Maya stepped to the opposite side of the table. Foster looked up, her forehead beaded with sweat. Entry wound left upper quadrant. Bullet still in there somewhere. I've got free blood in the peritoneum, but I can't find the source. I think it's retroperitoneal, but I can't get good visualization. Blood pressure's dropping. 60/35. Maya's hands were already in the cavity, feeling, probing, reading the anatomy through touch more than sight. The bullet had tracked through the spleen. That much was obvious from the fragments of tissue. But the major bleeding was coming from somewhere else. Somewhere Foster couldn't see because she was looking in the wrong place. Spleen's gone. Maya's fingers found the splenic artery, pulsing weakly. But that's not what's killing her. The bullet kept going. She palpated deeper, into the retroperitoneal space. There, splenic artery is lacerated proximally. She looked at Chen. 40 proline suture, vascular clamps, and call vascular surgery. Tell them we need them now. Foster watched as Maya exposed the damaged vessel, clamped it above and below the injury, and began to repair it with small, precise stitches. The kind of repair that should take 30 minutes in an OR, done in under 3 in the middle of an emergency department with inadequate lighting and improvised positioning. How did you know? Foster's voice was quiet. I had my hands in there for 10 minutes and couldn't find it. Because I've done this before. Maya tied off the last stitch. In places where you don't have time for imaging, where you can't wait for perfect visualization. You learn to feel instead of see. Monitor. Blood pressure climbing. 50/40, 60/42, 70/48. She's stable. Pack the abdomen. She needs formal surgical repair, but she'll make it to the OR now. Maya was already stripping off her blood-soaked gloves, already moving toward Bay 3 before Foster could respond. Bay 3 was chaos. Dr. Hassan had blood up to his elbows, and the expression of a man watching everything fall apart. The patient with the femoral artery injury was on the table, the tourniquet still in place on his thigh, but Hassan had made an incision trying to find the severed vessel and failed. Blood poured from the wound despite his attempts to clamp blindly into the tissue. I can't find the proximal end. Hassan's voice was tight. The artery retracted into the muscle. I've been trying to clamp it, but I can't get control. Maya assessed the situation in 3 seconds. Move. She didn't wait for him to step aside. Her hands went to the groin, above the injury site. New incision. Proximal control first. The scalpel cut through skin and fascia with swift precision. Her fingers palpated for the femoral pulse above the damage. There. She felt the vessel pulsing beneath her fingertips. Vascular clamp. Chen handed it over. Maya's fingers guided the clamp into position, feeling more than seeing, and closed it around the artery. The bleeding stopped instantly. Hassan stared. How did you do that blind? Practice. Maya's voice was matter-of-fact. In Fallujah, I did this on a marine in a sandstorm with a flashlight. You learn to work by feel. She looked at Chen. Get vascular surgery down here. This needs formal repair, but he's got time now. She stepped back from Bay 3, and the enormity of what had just happened settled over the emergency department like a heavy blanket. 3 trauma bays, 3 coding patients, 3 saves in 8 minutes and 50 seconds. The monitors told the story. Stable rhythms, rising blood pressures, lives pulled back from the edge. Maya looked at her hands. They were covered in blood, steady as stone, not a tremor visible. Around her, the emergency department had gone quiet. Nurses stood frozen. Residents watched her with expressions that ranged from awe to disbelief. Even the monitors seemed to beep more quietly, as if acknowledging that something impossible had just occurred. Dr. Carmichael stood at the central station. His face had gone through shock and was settling into something Maya couldn't quite read. Dr. Santos. His voice sounded hollow. "What are you?" Before Maya could answer, the automatic doors opened. 3 people entered. 2 wore dark suits with badges on their belts. The third was a woman in her 50s, sharp-eyed and dressed in business attire. The lead agent, a tall man with graying temples, walked directly toward Maya. Major Maya Elena Santos? His voice carried the authority of someone used to being obeyed. Maya felt her carefully constructed civilian identity crumbling. "Yes, I'm Special Agent Williams, FBI." The man held up his credentials. "We need to talk about why you disappeared from the United States Army Medical Corps 6 months ago." The emergency department seemed to contract around Maya, the walls closing in despite the high ceilings and bright lights. Every eye in the room was on her now. The nurses who'd watched her save 3 lives. The residents who'd frozen while she worked. Dr. Carmichael, whose face had gone from red to pale to something approaching gray. And now the FBI, standing in the middle of her carefully constructed refuge, asking questions she'd spent 6 months avoiding. "I didn't disappear." Maya kept her voice level. "Professional. I resigned my commission. That's a matter of public record." Agent Williams pulled a tablet from his jacket and tapped the screen. "Major Maya Elena Santos. 8 years with the United States Army Medical Corps. 3 combat deployments: Iraq, Afghanistan, Syria. 617 documented surgeries in field conditions. Silver Star for Valor. 3 Bronze Stars. Purple Heart." He looked up from the screen. "You were one of the best combat surgeons in the military. And then, 6 months ago, you submitted your resignation effective immediately and disappeared." "I didn't disappear. I moved to Chicago. I applied for a civilian residency. I've been working here since August, under an incomplete file." Williams swiped to another screen. "Your application to this hospital listed 2 years of general practice experience. You failed to mention 8 years of military trauma surgery. Why?" Maya felt the weight of every gaze pressing down on her shoulders. "Because I wanted to leave that behind. I wanted to learn civilian medicine. I wanted to be someone different." "Someone different," Williams repeated. "Or someone who was running from something?" Before Maya could respond, a voice cut through the tension. She wasn't running from anything. Captain James Rodriguez stood at the entrance to Bay 6, his right arm in a sling, his uniform jacket draped over his shoulders. He walked toward the center of the department, his steps measured despite the pain he had to be in. She was running toward something. Toward a life where every patient isn't a combat casualty, where every surgery isn't performed while mortars fall. "Captain Rodriguez." Williams turned to face him. "You're supposed to be receiving treatment." "I've received treatment." Rodriguez looked at Maya, and there was something in his expression that looked like understanding. "Major Santos saved my life in Ramadi in 2019. IED attack, 7 casualties. She operated on all of us in a field hospital while enemy forces were closing in. 6 of us survived." He paused. "1 didn't. Private Marcus Webb, 19 years old. He died on her table while she was working to stabilize the rest of us." The name hit Maya like a physical blow. She closed her eyes for a moment, and she was back there, the heat of the Afghan sun beating down on the canvas tent, the smell of blood and diesel fuel, the sound of mortars falling, getting closer with each explosion. And Marcus Webb, so young, bleeding from wounds that were 98% fatal, begging her not to let him die. "The after-action report was classified," Williams said, but his voice had softened slightly. "It was declassified 2 weeks ago." He pulled up another document on his tablet and turned it toward Maya. "You were cleared of any wrongdoing. The investigation concluded that Private Webb's injuries were unsurvivable. You saved 6 soldiers while under fire. You were recommended for another commendation." Maya opened her eyes and looked at the screen. She'd never seen the full report. She'd resigned before it was completed, unable to face the investigation, unable to sit through the review that would dissect every decision she'd made that day. Tell that to his mother. Her voice was barely above a whisper. Tell that to the family who got a folded flag instead of their son. We did. Williams's voice was quiet now, gentle even. Private Webb's mother, Sarah Webb, submitted a statement to the investigation. She said she wanted to meet you. She wanted to thank you for trying to save her son when command ordered you to evacuate. The room was silent. Maya could feel tears threatening, the kind she'd been holding back for 6 months, the kind that came with trauma that never quite healed. I made a choice. I prioritized the soldiers who had the best chance of survival, and Marcus died because of that choice. You made the right choice. Dr. Carmichael's voice startled everyone. He stepped forward. His expression transformed from anger to something that looked almost like compassion. You did what combat medicine requires. You saved the maximum number of lives with the resources you had. That's not failure, Dr. Santos. That's exactly what a trauma surgeon is supposed to do. Maya looked at him. This man who'd fired her hours ago, who'd mocked her boots and questioned her judgment. Why are you saying this now? Because I was wrong. Carmichael's voice was steady. I've been a trauma surgeon for 30 years. I thought I understood emergency medicine. But what you did today, what you just did with 3 dying patients in 8 minutes, that's a level of skill I've never witnessed. He paused. You're not just a good surgeon, Major Santos. You're exceptional. And I'm sorry I couldn't see that until you had to prove it. The second agent, who'd been silent until now, stepped forward. She was older than Williams, her gray hair pulled back in a severe bun, her eyes sharp and assessing. Major Santos, I'm Deputy Director Martinez from the Department of Defense Medical Command. We've been tracking your resignation for the past 6 months. Not because you did anything wrong, but because surgeons with your level of field experience are rare. Invaluable, actually. I'm not going back. Maya's voice was firm. I can't go back to that. We're not asking you to. Martinez pulled out a folder, actual paper rather than digital, and handed it to Maya. We're offering you something different. A position as director of the new Civilian Military Trauma Integration Program, based here in Chicago. Your job would be to train civilian surgeons in combat trauma techniques, to bridge the gap between military medicine and civilian emergency response. Maya opened the folder. The first page was a formal job offer from the Department of Defense. The second page was a letter on official stationery. She recognized the signature at the bottom. The Secretary of Defense. Your program would be the first of its kind, Martinez continued. Teaching civilian doctors the techniques that save lives in war zones. Techniques that could save lives here, in mass casualty events, in situations where traditional protocols aren't enough. You'd be creating something that's never existed before. Maya looked around the emergency department. At Chen, who'd believed in her when no one else did. At Park and Foster and Hassan, who'd watched her work and seen what combat medicine could do. At Carmichael, who'd gone from antagonist to advocate in the span of a morning. At Rodriguez, standing there in his dress uniform, a living reminder of the soldiers she'd saved. Then the monitor in Bay 1 started alarming. The police officer she'd saved was crashing again. Dr. Park's voice called out, urgent and strained. He's back in V-fib. Something's wrong. Maya didn't hesitate. She moved to Bay 1, Williams and Martinez following behind her. The officer was on the table, his chest still open from the thoracotomy, and his heart was fibrillating, the muscle quivering uselessly instead of beating. Ultrasound. Maya's hands were already working. She placed the probe on the heart, angling to see all the chambers. There, pericardial tamponade, slow bleed from the cardiac repair site. It's accumulated enough to compress the ventricle. We need to get him to the OR, Park said. No time. Maya's hands moved with the speed born from doing this too many times to count. Emergency pericardial window. Here. Now. She made a swift incision below the sternum, her fingers dissecting through tissue to reach the pericardium. The membrane bulged with accumulated blood. Retractor. Chen handed her the instrument. Maya opened the window, and dark blood evacuated from around the heart. She could see the source now. A small tear in the right ventricular wall, oozing blood that had been building up slowly. 40-proline with pledgets. Her voice was calm despite the alarms, despite the pressure, Despite the fact that everyone in the room was watching her perform a procedure most cardiac surgeons would hesitate to do without full surgical backup. The suture appeared in her hand. Maya placed a figure-of-8 stitch around the tear, the pledgets distributing pressure to prevent the suture from tearing through the fragile cardiac tissue. 1 throw, 2, 3. She tied it off and cut the suture. The monitor changed. The fibrillation stopped. The heart contracted once, twice. A normal rhythm established itself. Blood pressure began to rise. 60/40, 80/50, 100/65. Park stared at the monitor, then at Maya. That was 4 minutes from diagnosis to repair. I've never seen emergency cardiac surgery work that fast. In Baghdad, Maya said quietly, I did this 11 times. You learn to work quickly. She looked at Williams and Martinez, who were standing at the entrance to the bay, watching everything. Or you learn that some skills are too important to abandon just because you want to escape the memories that come with them. The officer in Bay 1 stabilized quickly after the cardiac repair. His blood pressure held steady at 115/72. Heart rate normalized to 86. The monitors beeped their reassuring rhythm, a stark contrast to the flatline that had filled the room minutes earlier. Maya stepped back from the table, stripping off her gloves for what felt like the 100th time that morning, and allowed herself a single deep breath. Around her, the emergency department was beginning to settle into a new kind of quiet. Not the silence of shock, but the stillness that comes after a storm when everyone is too exhausted to do anything but process what just happened. Dr. Park stood at the nursing station, documenting the procedures with hands that still trembled slightly. Dr. Foster was in Bay 2, monitoring her patient as transport prepared to move her to the operating room. Dr. Hassan had finally achieved definitive vascular control in Bay 3 and was coordinating with the vascular surgery team. 4 lives saved. Maya let that sink in. Michael Torres with his cardiac tamponade, the police officer with his shredded lung, the woman with the retroperitoneal bleed, the man with the severed femoral artery. 4 people who would have died if she'd stayed in that locker room, if she'd walked away when Carmichael told her to leave, if she'd chosen to keep hiding from who she really was. Dr. Carmichael approached slowly. His usual commanding presence diminished somehow. He looked older than he had that morning, the lines around his eyes deeper, his shoulders slightly hunched. When he spoke, his voice carried none of its earlier arrogance. Major Santos, I need to speak with you. Privately. Maya glanced at Agent Williams and Deputy Director Martinez, who were still standing near Bay 1, watching everything with the careful attention of people who made careers out of reading situations and making judgments. Williams nodded slightly, giving her permission to step away, though Maya wasn't entirely sure she needed it. She followed Carmichael to a small consultation room off the main corridor. The space was barely large enough for a desk, 2 chairs, and a wall-mounted anatomy poster that had faded from years of fluorescent light exposure. Carmichael closed the door and leaned against the desk, his arms crossed, but not in the defensive way they'd been crossed that morning. This was different. This was a man trying to hold himself together. I fired you this morning. He stated it as a fact, not an accusation. I stood in that conference room and told you that you had no place in this hospital. I mocked your boots, questioned your judgment, and dismissed your concerns about Mr. Torres even when you were clearly right. He paused, his jaw working as if the next words were physically difficult to speak. I was wrong. About everything. Maya said nothing. She'd learned in the military that sometimes the most powerful response was silence. Let people fill the void with their own truths. I've been director of this emergency department for 12 years, Carmichael continued. I've trained over 60 residents. I thought I understood trauma medicine. But what you did today, what you did in less than 9 minutes with 3 patients who were essentially dead, that's a level of skill and intuition I've never witnessed. He met her eyes. You operated on that officer's heart in an open bay without full surgical backup. You found a retroperitoneal bleed that Dr. Foster couldn't visualize. You achieved vascular control blind in a femoral artery injury. Those aren't just good techniques, Major Santos. Those are the kind of skills that come from hundreds of repetitions under impossible conditions. 617 surgeries. Maya's voice was quiet. in 8 years. In field hospitals, forward operating bases, makeshift surgical sites under mortar fire, you learn to work fast when the next explosion might collapse the tent you're operating in. Carmichael nodded slowly. I can't imagine what that was like. I've worked in level 1 trauma centers my entire career. Climate-controlled operating rooms, full surgical teams, all the equipment I could ever need. He gestured toward the door, toward the emergency department beyond. And I froze today. When those 3 patients started crashing simultaneously, I didn't know who to save first. I stood there like a first-year medical student while people died. You didn't freeze, Maya said. You hesitated. There's a difference. Hesitation comes from trying to make the perfect decision. Freezing comes from fear. You were trying to calculate the best approach, trying to follow protocols designed for single-patient scenarios. But mass casualty situations don't work that way. You have to make imperfect choices quickly and live with the consequences. And you learned that in combat. It wasn't a question. I learned it because I didn't have a choice. Maya felt the weight of memory pressing down on her shoulders. When you're the only surgeon in a field hospital and 7 casualties come in at once, you don't get to hesitate. You triage. You prioritize. You save the ones you can and accept that you can't save them all. She closed her eyes briefly. Even when one of the ones you can't save is 19 years old and begging you not to let him die. Private Webb. Carmichael had obviously been listening to the conversation with Agent Williams, the one Captain Rodriguez mentioned. Marcus Webb. Maya opened her eyes. He was the 7th casualty that day. IED attack on a convoy outside Kandahar. 6 of the soldiers had survivable injuries if I worked fast enough. Marcus had a severed femoral artery, massive internal bleeding, and shrapnel in his chest. 98% fatal, even under ideal conditions. I made the choice to stabilize the other 6 first, because they had better odds. Marcus died while I was working on soldier number 5. That's exactly what combat triage protocols require. Carmichael's voice was gentle. Maximum lives saved with available resources. You made the right call. Tell that to the part of me that hears him calling my name every time I close my eyes. Maya's voice cracked slightly. Tell that to the guilt that made me resign my commission and spend 6 months pretending to be someone I'm not, because I couldn't face another situation where I'd have to choose who lives and who dies. The room fell silent. Outside, Maya could hear the muted sounds of the emergency department. A phone ringing, someone calling for a wheelchair. The everyday sounds of a hospital that had just survived something extraordinary. Finally, Carmichael spoke. I'm not going to pretend I understand what you've been through. I can't, but I do understand that what you did today saved 4 lives that would have been lost. And I think you need to hear that you didn't fail Private Webb. You saved 6 other soldiers. 6 people who went home to their families because of decisions you made under impossible conditions. Maya felt tears threatening, the kind she'd been suppressing for 6 months. Knowing something intellectually and accepting it emotionally are 2 very different things, Director. I know. Carmichael straightened up. Which is why I'm going to ask you something, and I want you to know there's no wrong answer. He pulled an envelope from his jacket pocket. This is a formal offer for a position here at St. Vincent's, Director of Trauma Innovation and Military-Civilian Integration. You'd be creating a training program to teach residents and attending physicians the combat trauma techniques you use today, full attending privileges, complete autonomy over curriculum and staff selection, your own budget for equipment and simulation training. Maya took the envelope but didn't open it. Why would you offer me this? I violated every protocol in your department. I performed procedures without authorization. I'm the nightmare scenario for hospital risk management. Because you saved lives that my staff couldn't save. Because you have knowledge and skills that could transform how we handle mass casualty events. And because, Carmichael's voice softened, I think you need this as much as we need you. You've been running from your past for 6 months. Maybe it's time to use that past to build something better. Maya opened the envelope. The letter inside was formal, typed on hospital stationery, outlining responsibilities and compensation. But what caught her attention was the handwritten note at the bottom in Carmichael's distinctive scrawl. Your boots belong here. So do you. She looked up at him. And for the first time since that morning, She saw not an antagonist, but an ally. Someone who'd made mistakes and owned them. Someone who'd been humbled and learned from it. I have 3 conditions. Name them. First, this program is open to anyone with relevant experience. Military, civilian, international. I don't care about pedigree or credentials. Skills matter. Second, we create a rapid response team that can deploy to mass casualty events beyond this hospital. Chicago-wide, eventually nationwide. And third, Maya paused, her throat tight. We named the training program the Marcus Webb Trauma Fellowship. So his name saves lives instead of representing my failure. Carmichael extended his hand. All 3 conditions accepted. Welcome to St. Vincent's, Dr. Santos. Officially this time. Maya shook his hand, feeling something shift inside her chest. Not quite healing, but maybe the beginning of it. The start of accepting that trauma doesn't have to define you. That skills born from pain can still save lives. That running from your past doesn't make it disappear, but using it to build something better might make it bearable. They walked back into the emergency department together, and Maya saw the future beginning to take shape. 3 months later, Maya stood at the front of a lecture hall in the education wing of St. Vincent's Hospital. 12 physicians sat in rows before her, notebooks open. Expressions ranging from eager anticipation to cautious skepticism. The first class of the Marcus Webb Trauma Fellowship. 3 emergency medicine attendings from other hospitals in Chicago. 4 surgical residents looking to specialize in trauma. 2 military medics transitioning to civilian practice. 2 international physicians from trauma centers in South America. And Dr. Kevin Park, who'd requested to join the program after watching Maya work that day in October. Behind her, a whiteboard displayed the course title in her own handwriting. Combat Trauma Techniques. Module 1. Damage Control Surgery in Resource-Limited Environments. To the right of the board, a framed photograph hung on the wall. Private Marcus Webb in his dress uniform, 19 years old, smiling at the camera. Beneath it, a small plaque. This program is dedicated to Private Marcus Webb, who gave his life in service. May his name save the lives his loss could not. Good morning. Maya's voice carried clearly through the room. Over the next 6 months, you're going to learn techniques that most civilian surgeons never encounter. Techniques designed for situations where protocols fail, where resources are limited, and where the only metric that matters is survival. Some of what I teach you will seem extreme. Some will seem to violate every principle of modern surgical practice. But everything you learn here has been proven effective in the field, where field means combat zones, mass casualty events, and situations where waiting for ideal conditions means watching patients die. She clicked to the first slide. A photograph of a field hospital, canvas tent, blood-stained gurneys, surgeons working in desert camouflage with headlamps because the generator had failed. This is where I learned combat medicine. Forward operating base outside Kandahar, Afghanistan. 2019. We had 1 surgical team for a region that covered 300 square miles. No CT scanner, no MRI, no vascular surgery backup. Just us, our training, and whatever supplies we could get on helicopters that came once a week if we were lucky. One of the attendings, a woman in her 40s named Dr. Sarah Chen, raised her hand. How did you make diagnostic decisions without imaging? Touch, sound, and pattern recognition. Maya moved to the next slide showing an ultrasound machine, old and worn but functional. We had 1 portable ultrasound. Everything else was physical examination. You learn to feel the difference between blood and air in a chest cavity. You learn to hear the subtle changes in breath sounds that indicate a developing pneumothorax. You learn to recognize injury patterns because you've seen them dozens of times before. She paused. And you learn to accept that sometimes you'll be wrong, and you make peace with that before it happens. The room was silent. Maya could see the weight of that statement settling over them. These were skilled physicians, all of them. But most had trained in environments where wrong decisions meant lawsuits, not death, where protocols existed to protect both patients and doctors, where uncertainty could be resolved with another test, another consultation, another day to think. Today we're going to focus on emergency thoracotomy. Maya gestured toward the simulation lab visible through the glass partition. The kind you do in the emergency department when a patient is dying, and you have maybe 2 minutes to save them. Dr. Park, would you join me? Park stood and walked to the front. He'd changed in the 3 months since that October morning. More confident, more willing to acknowledge what he didn't know. He'd been the first to request a spot in the fellowship program, and Maya had accepted without hesitation. Dr. Park, describe what happened in Bay 1 on October 15th. Maya's voice was gentle but firm. Tell them what you saw when that police officer came in with a gunshot wound to the chest. Park took a breath. He was dying. Massive hemothorax. I placed a chest tube, but it wasn't draining effectively. The bleeding was too fast, the lung too damaged. He paused. I froze. I knew what needed to happen, knew I needed to open his chest, but I couldn't make myself do it. Every protocol I'd learned said to stabilize and get to the OR. But there was no time. And then? Maya prompted. And then Dr. Santos took over. Park looked at her. She performed an emergency thoracotomy right there in the bay. Found the bleeding vessel, clamped it, tied it off. Got his heart beating again with direct cardiac massage. The whole procedure took maybe 4 minutes. He looked back at the class. 4 minutes. And that officer is alive today because she didn't wait for protocols to save him. Maya pulled back a sheet covering a surgical mannequin on a gurney. This is your patient. Gunshot wound to the chest. Flatlined in the ambulance. You have 2 minutes before brain death becomes irreversible. She handed Park a scalpel. Show them what you've learned. What happened next would have terrified most surgical educators. Park made the incision with swift confidence. Inserted the rib spreader. Identified the simulated bleeding source. Clamped it. His movements weren't as fast as Maya's, but they were sure, practiced. He'd spent 3 months in the simulation lab, repeating this procedure until it became automatic. Time. Maya clicked the stopwatch she'd been holding. 3 minutes, 40 seconds. That's acceptable for a first attempt under observation. In a real scenario, you'd want it under 3, but you'd save the patient. She looked at the class. This is what training looks like. Repetition until fear is replaced by muscle memory. Practice until the impossible becomes routine. The door to the lecture hall opened. Dr. Carmichael entered, followed by a woman Maya didn't recognize, and a man in his 50s wearing a suit. The woman was thin, with gray-streaked hair, and eyes that looked like they'd seen too much grief. She walked directly toward Maya, her steps hesitant. Dr. Santos? Her voice wavered slightly. I'm Sarah Webb, Marcus's mother. Maya felt her breath catch. Mrs. Webb, I'm so sorry. I tried everything I could to save your son. Sarah Webb reached out and took Maya's hands in hers. I know you did. I read the after-action report. 7 casualties, all critical. You saved 6 of them while mortars were falling around you. She paused, tears streaming down her face. My son died doing what he believed in, but because of the choices you made that day, 6 other mothers got to keep their sons. 6 families stayed whole. And now, because of this program you've created, hundreds more people will survive injuries that would have killed them. Maya couldn't speak. She could only stand there while this woman, this mother who'd lost everything, thanked her for making the choice that had kept Marcus on that table until it was too late. This program. Sarah Webb looked around the lecture hall. Marcus would be so proud that his name is attached to something that saves lives, that his death meant something beyond grief. The man in the suit stepped forward. I'm Robert Chen, Director of FEMA Disaster Response. He handed Maya a folder. We've been following your program for the past 3 months. The survival rate for penetrating trauma at St. Vincent's has increased by 34%. Your residents are performing procedures that most trauma centers can't handle. He opened the folder. We want to implement your training program nationally. 50 hospitals in 25 states. Train 500 physicians over the next 2 years in combat trauma techniques. Maya looked at the folder, at the scope of what was being offered. This is larger than I imagined. It needs to be, Carmichael said, joining the group. Mass casualty events are increasing. Active shooters, natural disasters, industrial accidents. We need physicians trained to handle situations where protocols fail, and you've proven the model works. Before Maya could respond, her radio crackled. All available Webb fellows to the emergency department. Mass casualty alert. Train derailment. Multiple critical patients. ETA 6 minutes. Maya looked at her class, at these 12 physicians who'd spent 3 months learning to think like combat surgeons. This is what we trained for. Let's show them what Webb Fellows can do. They moved as a unit, confident and coordinated. Maya led them into the emergency department where Nurse Chen was already coordinating bay assignments. The automatic doors opened, and the first ambulance arrived. Then another. Then 3 more. But this time, Maya wasn't alone. She had a team trained in the same techniques, armed with the same knowledge, ready to save lives that would have been lost 3 months ago. Dr. Park took the first trauma. One of the international fellows took the second. An emergency medicine attending took the third. They moved with practiced efficiency, calling out findings, performing procedures, stabilizing patients. Maya stood at the central station, watching her students work, and felt something she hadn't felt in a long time. Not quite peace, but maybe the beginning of it. The knowledge that Marcus Webb's death, and all the pain that came with it, had been transformed into something that saved lives. That her 8 years of combat experience, all the trauma and guilt and sleepless nights, had meaning beyond survival. Captain Rodriguez appeared at her elbow, his shoulder healed, back in full uniform. You did it, Major. You took everything combat taught you and made it save lives here at home. Maya watched Dr. Park successfully perform a damage control laparotomy on a patient with abdominal trauma. Watched an international fellow achieve vascular control on a femoral artery injury. Watched her students become the surgeons she'd trained them to be. This is just the beginning, Captain. 50 hospitals, 500 physicians, thousands of lives saved because someone taught them that sometimes you have to break protocols to save patients. The emergency department hummed with controlled urgency. Monitors beeped. Nurses called out vitals. Fellows worked with hands that no longer trembled, making decisions that months ago would have paralyzed them. And on the wall in the education wing, Private Marcus Webb's photograph looked down on the program that bore his name, a reminder that even in loss, there could be legacy. Maya pulled on fresh gloves and moved toward Bay 4, where a patient needed her expertise. The journey from fired resident to program director had taken 3 months and a lifetime. But standing there, surrounded by physicians she'd trained, knowing that her skills would ripple outward to save lives she'd never see, Maya finally understood something important. You don't heal from trauma by running from it. You heal by using it to build something better. And sometimes the skills born from your darkest moments become the light that guides others through theirs.